just by taking the pill, or does it have to be snorted, or
in order to get
my thought on this is kids don't start out sticking needles in their bodies.
No, but
they
do
start. They'll snort it. So most of them are snorting it. Is that what they're doing?
In order to get the best high, you have to snort it. So
they're not taking it as a pill. I always,
because you really don't
get lessons, but yeah, so this is a surprise to me. I thought they were taking it as pills.
Actually, you can get a high just from taking it by mouth.
You can, but it's not going to be as equal.
Most people are going to start out taking it by mouth,
okay.
And the effect for someone who's taking it for the first time, they're going to get high, but as gradually the longer you take it, you develop what's called tolerance,
right,
where you need more and more of the medication to get the same effect of euphoria, which is what they're looking for, and then you have to change the route that you're giving the medication, and then you have to move to snorting and then injection. So it's a progressive.
The speaker said when it goes right to the brain.
Yes, correct.
It goes right to the brain, and that's the fastest. And that's what they normally do if they're aware of this, and they are aware of it.
Correct. Actually, I heard you sort of mutter it, but you're correct. Actually, snorting gets things to your brain really quickly, and it's almost equivalent to injecting. Most people really don't know that.
And we also left out the other
smoking.
No, rec, yeah, also, and rec, you can administer these medications rectally and bypass the liver.
And the first pass effects,
so it's faster.
There are two very effective ways of actually administering medication that, again, the ingenuity is impressive.
You're paying $80, I guess you want to get the biggest bang for your buck, right? I'm sure that's what's in their head, but I did always just assume that they were taking, the teenagers at least, are taking these pills orally.
That's usually how they begin.
So they start and then they progress.
Right.
Okay.
No, I think actually, as we're hearing, they are all aware that you can get a high from it. And the most effective way, as you said, is snorting. So they generally snort drugs. Or if they're taking it orally, it's with alcohol. And I think that's a very important point to take away here, that if you want to die, you're going to take your drugs with alcohol and benzodiazepines. So interesting enough, these opioids generally don't kill you, believe it or not, but by themselves. It's actually when you're drinking mass quantities of alcohol with it and benzodiazepines, which tends to be the way how they're using it. So the more drugs that you're taking, it increases your risk for non-fatal or fatal overdose.
It is scary.
Right, yeah.
When we look at teens who have used prescription medications, they are twice as likely to use alcohol, which again makes sense, and they're usually doing it at the same time. 5 times more likely to use marijuana, 12 times more likely to use heroin, 15 times more likely to move on to things like ecstasy, and 21 more times more likely to advance to things like cocaine. And so those are all, in some ways we look at this as a gateway drug.
Right, and so the moral of the story, again, to really underscore the point, is that the kids who are at risk of using these drugs are starting off with good old marijuana and alcohol as well. And people fail to really realize that, and so we're just really looking at OxyContin, but that's going to come later on. So to really put our fingers on the pulse, so to speak, you really have to watch alcohol use and cannabis.
If we go back to one of the other myths that I'd like to debunk, it's that it's legal to be in possession of a prescription medication. Now, if it's a prescription medication that has not been prescribed to you, it is not legal. Okay? And if it is a controlled substance, meaning if it's anything from Vicodin to Percocet to a codeine-containing cough medicine, that would be a felony. Okay, and that's, again, it's something really, if they're worried about, if the kids are worried about, what's going to happen to their record, it's a felony if it's a controlled substance. It's a misdemeanor if it's not a controlled substance. But if they find medications on you that are not in a vial that has been written with all, a prescription vial with your name on it, it's not yours and it cannot be in your possession. Even as a pharmacist, I cannot actually have possession of narcotics that were not prescribed to me. I can't necessarily carry them around, and I can't take possession of them. And if somebody wants to try to give them back, if you try to actually take them back to a drugstore, by law, a pharmacist can't even do that. If we look at statistics now, and again, if you get pulled over and you've been drinking, first of all, they can smell on your breath. Secondly, they can give you a breathalyzer, and they'll pretty much know on the spot whether or not you've been drinking alcohol. There really is no on-the-spot test for prescription drug abuse. The only way that you can really look at it is to either do a blood test or a urine test. New York City drivers tested in a relatively small population after a fatal car accident, and this was in the year 2010, 1 in 6 tested positive for mind-altering chemicals that were not alcohol. Okay, and so we're actually seeing a very large increase in the number of alcohol or of automobile accidents that are due to the presence of mind-altering chemicals, not necessarily alcohol.